Hi everyone, this is Massage in a Time of COVID-19, a COVID-19 safety training for anyone and everyone in the massage profession. This is part 1. I'm Ann Williams. I'm the Director of Education for Massage Mastery Online. We create digital multimedia textbooks for massage students and massage professionals. This content comes from a digital textbook titled Preventing Disease Transmission in a Massage Practice. You can access your own copy for free at Massage Mastery Online. This content was verified or revised on July 3, 2020. Remember, COVID-19 continues to be a rapidly evolving situation. Please visit the CDC website, cdc.gov, to stay up to date on guidelines for healthcare professionals. Today we're taking a look at part 1, which is a big picture view of COVID-19. We'll talk about what this virus is, how it spreads, what's the symptom picture, and how do we self-monitor, who's at high risk, and how do we prevent the spread of COVID-19. Let's jump in by talking about what this virus is. Coronaviruses are a large group of viruses that cause disease in animals and humans. The name corona comes from the Latin for crown because these viruses have crown-like spikes when viewed under a microscope. 7 coronaviruses are known to cause disease in humans. 4 of these viruses are mild, producing upper respiratory illnesses like the common cold. These viruses can cause pneumonia in people with certain risk factors, but this is rare. Sometimes the coronaviruses that infect animals evolve and are transferred to humans, causing a higher occurrence of severe disease because humans have no immunity to these viruses. These instances are called spillover events, and they've occurred 3 times in the 21st century. In 2002, severe acute respiratory syndrome, or SARS, emerged in China. In 2012, Middle East respiratory syndrome, or MERS, emerged in Saudi Arabia. And coronavirus disease 2019, or COVID-19, emerged in China in 2019. The virus that causes COVID-19 is named Severe Acute Respiratory Syndrome Coronavirus 2, in other words, SARS-CoV-2. This differentiates it from SARS-CoV-1, which we discussed earlier. It emerged in 2002 in China. The World Health Organization declared COVID-19 a pandemic, a global outbreak of a disease, on March 11, 2020, and the United States declared it a U.S. national emergency on March 13th. Shortly after the March 13th declaration, most states in the U.S. locked down and issued stay-at-home orders to residents. Today, as I revise this video to reflect updates in information and research, states are opening back up, but we're seeing another spike in cases. All right, we know what COVID is. How exactly is COVID spread? We all know that COVID-19 is highly contagious. While information is still emerging, it's likely spread through large droplet and small droplet respiratory secretions. Research shows that an unblocked sneeze can disperse respiratory droplets that travel up to 18 feet on average. These droplets might fall to surfaces, or they might hang in the air and be inhaled by another person. But respiratory droplets don't just fly when people sneeze. They are also dispersed when people cough or even talk and laugh. If the person coughing, sneezing, or talking is infected with COVID-19, then uninfected people nearby might become infected in 3 different ways: droplet contact, direct contact, and indirect contact. In droplet contact, an infected person disperses respiratory droplets into the air around them through a cough, sneeze, talking, laughing, or even singing. Some of the droplets could land on the mouth, nose, or eyes of an uninfected person standing close by, or the droplets could be inhaled by this uninfected person. The virus has now gained entry into a new host, and the previously uninfected person may develop the disease. In direct contact, an infected person sneezes or coughs on their hands, or they touch their nose or mouth, getting respiratory secretions on their hands. Now they shake hands or touch another person with their contaminated hands. The previously uninfected person now has infected respiratory secretions on their hands or on their skin that they might then touch. When they put their hand up to their face to scratch an itch on their nose, they give the infection access to their body. With indirect contact, the infected person sneezes or coughs into their hands and they don't wash their hands. They now have contaminated respiratory droplets on their hands. Then they touch something like a door handle or a tabletop and spread the infection to the object. When an uninfected person comes along and touches the door handle or the tabletop, their hands pick up the infection. Eventually, those hands end up on their face and the virus gains entry to the body. Viral pathogens, including COVID-19, are shed in stool. When people flush the toilet without closing the lid, viral pathogens are dispersed into the air in small water droplets that then land on surfaces in the restroom. People touch these surfaces and contaminate their hands. Then if they don't wash their hands and exit the restroom, they can contaminate other surfaces. Eventually, they touch their face and give the virus entry to their body. Many public restrooms don't have toilet lids, so these places become more infectious. Researchers are currently debating about the degree to which COVID-19 might be transmitted in this way, and if COVID pathogens shed in stool are still active and able to cause disease. While much remains unknown, it's probably best to take every precaution and do a good job cleaning our massage clinic restrooms. We'll also want to wash our hands carefully after we use the restroom. While COVID-19 can probably spread to a small degree via indirect contact, including toilet plume, researchers tell us that direct contact and especially droplet contact are the primary means by which it travels from person to person. Close contact and prolonged contact with a person infected with COVID-19 increases the risk of becoming infected. Let's talk now about the concept of infectious dose. The infectious dose is the amount of virus needed to establish an infection. Depending on the virus, people need to be exposed to as little as 10 viral particles, for example, for influenza viruses, or thousands to get infected. Currently, scientists do not know how many virus particles of SARS-CoV-2 are needed to trigger an infection. COVID-19 is very contagious, and this may be because very few particles are needed for infection. In other words, the infectious dose is low, or because infected people release a lot of virus into their environment. This is still unknown. Let's talk now about viral load. The viral load is the amount of a specific virus in a test sample taken from a patient. For COVID-19, that means how many viral genomes are detected in a nasal swab from the patient. The viral load reflects how well a virus is replicating in an infected person. A high viral load for SARS-CoV-2 detected in a patient swab means a large number of coronavirus particles are present in the patient. With SARS-CoV-2, the viral load doesn't necessarily mean a person will develop a more severe illness. In fact, some studies found that asymptomatic patients had the similar viral loads to patients with symptoms. This means the viral load alone is not a clear predictor of disease outcome. In general, the more viral particles you have in your airways, the more you will release when you exhale or cough, although there's a lot of person-to-person variation. Multiple studies have reported that patients have the highest viral load of the coronavirus at the time when they're diagnosed. This means that patients transmit COVID-19 more effectively at the beginning of their illness or even before they know they're sick. This is bad news. It means people who look and feel healthy can transmit coronavirus 19 to others. Well, we know something about how COVID-19 is spread. What's the symptom picture for this disease? First of all, shortness of breath, a feeling of breathlessness, difficulty breathing, air hunger, and the sense that you can't pull air deeply into your lungs. A fever, that means a temperature of 100.4 degrees Fahrenheit or 38 degrees centigrade or higher. This usually indicates a fever caused by an infectious disease. A dry cough. People say that this cough feels different from a cough produced by throat irritation. It's described as low, inflamed, and from the lungs. Chills. Many people report mild chills to intense shivering with a spike in fever. Some people report muscle weakness, aching joints, and numbness and tingling in their hands and feet. Fatigue, extreme tiredness, weariness, and exhaustion are widely reported with COVID-19. Around 14% of people report a mild sore throat as a symptom of COVID-19. Loss of taste or smell. Some people report that they lose their sense of taste and smell. This usually occurs with mild cases of COVID-19. Some people report low-grade headache pain as a symptom. In a few clients or patients altered mental states, bewilderment, delirium, confusion, seizure, and stroke may occur. Some patients report digestive issues, including nausea, vomiting, diarrhea, loss of appetite, and abdominal pain. Oftentimes, people will get digestive issues, seem to get over the disease, and then develop respiratory issues. Conjunctivitis. Around 3% of people with COVID-19 develop conjunctivitis, commonly known as pink eye. Around 5% report nasal congestion as a symptom of COVID-19. Emerging reports find that some people testing positive for COVID-19 develop odd skin rashes and blisters and inflammation on their toes that's been nicknamed COVID toe. And this is a picture of COVID toe here. New research shows that seriously ill patients may experience extensive damage to the linings of blood vessels, abnormal blood vessel growth in the lungs, and widespread blood clotting. Damaged blood vessels may underlie COVID toe and multi-symptom inflammatory syndrome in children. And it might also underlie some of the clients who end up having a stroke. Severe cases cause respiratory distress, hospitalization, pneumonia, and possible death. Around 35% of people who become infected with COVID-19 are asymptomatic carriers. These people show no symptoms of illness and never develop symptoms of the disease, but they are infected with COVID-19 and they can transmit it to other people. A pre-symptomatic carrier will develop symptoms of COVID later. The carrier is still in the early stages of COVID-19. Studies show that pre-symptomatic spread is more common than asymptomatic spread. We need to understand the broad range of symptoms associated with COVID-19 to help us recognize illness in clients arriving at our clinic and as part of our practice of self-monitoring. If we decide to reopen our practices in communities where COVID-19 is still present, and right now that means just about everywhere, then we're going to have to act very responsibly and unselfishly. We need to continue to socially distance so that when we do see clients, we're less likely to have picked up COVID-19 from being out and about with our friends and family. We'll also need to monitor our own health on a daily basis. Take your temperature before the workday and then again in the afternoon when viruses tend to spike temperature. Remember that COVID-19 causes a wide range of bizarre symptoms. Treat any new symptom as suspicious. The most common symptoms are mild cold or flu-like symptoms, especially a cough, sore throat, and shortness of breath. If you do develop a temperature or symptoms, call in sick and self-isolate for 14 days. But remember, this 2-week rule that we've arrived at is pretty general. Many people are sick and infectious for longer than 2 weeks. Make sure to consult with your physician or seek out testing on COVID-19 so that you can be cleared of infection and return to work. Well done, us. We have self-monitored who now is at high risk for developing serious illness from COVID-19. People age 65 or older are at higher risk of serious COVID-19 illness, as are people who are pregnant. People with neurological conditions are at higher risk. That means dementia, epilepsy, Alzheimer's, Parkinson's. People with chronic lung or respiratory diseases, including chronic obstructive pulmonary disease, pulmonary fibrosis, moderate to severe asthma, cystic fibrosis, or smokers. People with blood diseases and people with heart and vascular conditions like high blood pressure, heart failure, heart disease, or cerebral vascular disease, which affects blood vessels and the blood supply to the brain. People with compromised or suppressed immunity from things like HIV/AIDS, cancer treatments, medications, or the long-term use of corticosteroids. People with a body mass index of 30 or higher. Originally, the CDC said 40 or higher, but they have since dropped that number to body mass index of 30 or higher. People with type 1 or type 2 diabetes, people with chronic kidney diseases, people with chronic liver diseases. And these estimates are from July 1st, 2020. Hospitalizations are 6 times higher and deaths are 12 times higher for COVID-19 patients with reported underlying conditions. So if you're a massage therapist or if you're a massage student with any of these underlying health conditions, you'll want to speak to your doctor before you return to massage practice or massage school. And the same is true of your clients. If your clients have these underlying health conditions, they should discuss their health picture with their physician and decide if massage is right for them right now. They may want to forego massage while COVID-19 is still present in the community. Let's talk now about general prevention of COVID-19. And we know this from the CDC and from all of the different health reports and news items we've been watching. Remember to wash your hands often with soap and water for at least 20 seconds. If soap and water is not available, use an alcohol-based hand sanitizer. It must contain between 60 to 95% alcohol to be effective. Avoid touching your face as much as possible, and if possible, wash your face during the day. Continue to avoid close contact with people. Keep 6 feet of distance between you and others. No hugging, no kissing, no handshakes. Remember to wear a face mask in public and make sure that it fits comfortably. If you're constantly reaching up to adjust your mask, you might transfer pathogens to your face, which would then give a disease entry to your body. If you feel sick, stay home. If you have any new symptoms that suggest you've got anything, stay home and contact your primary care physician for consultation. The CDC reports that a small number of pets, like cats and dogs, have developed COVID-19 through close contact with sick owners. So if you get sick, hand off your pet to a friend to watch until you get better. If you're caring for someone recovering from COVID-19, remember they should stay isolated as much as possible. And if you are caring for someone with COVID-19, you shouldn't attend school or practice massage because you could be a pre-symptomatic carrier of the disease. If you or someone you're caring for needs medical help, make sure that you call ahead before you travel to an urgent care facility or your doctor's office. This gives them a chance to prepare for you. But if you're having difficulty breathing or if your symptoms are intense, call 911. Home isolation. 80%, that's most people, recover from COVID-19 at home. If you're sick, separate yourself from others in your home and use a separate bathroom if at all possible. Well done! We have completed part 1 of Massage in a Time of COVID-19. We now have a great big picture understanding of COVID-19. Next up, part 2, where we'll take a hard look at standard precautions related to COVID-19. Remember, all of the notes for these presentations come from Preventing Disease Transmission in a Massage Practice. You can access it for free at massagemastery.online. Thanks so much for being with me, and I hope you'll visit me soon at massagemastery.online. Take care.